Hi, everyone. Let me go through the questions, answers, and rationale for the second exam in our healthcare ethics class. Um, okay, so the first question has to do with a case. Christian refuses to be tested for HIV. Um, he has intact mental status, so he's fine to make his own decisions. The question is, how should the clinical staff react? Things that you probably want to highlight. He refuses. Of course, um, we're not exactly sure what the issue is, but the question is, how should the clinical staff react? Um, this is where, of course, informed consent, since he is able to consent, takes precedence, even if the answer is no. He really has the autonomy and the agency. Now, a good portion of you chose C. It's Christian's right to conscientiously, I spell that wrong, but conscientiously object to the test. His wishes should be honored. His wishes should be honored is, sure, correct. When it comes to objections of conscience, this is actually not an objection of conscience. Objection of conscience refers primarily to healthcare professionals, not patients. He's just declining. It's really not a conscientious objection. However, in the rationale, many of you who chose C did say he's exercising autonomy. So even though the answer is D, again, we're focused on the ethics issue here, which is informed consent, testing of anything. Um, I awarded a point just because you focused on the autonomy part, but conscientious objection really is about the healthcare provider, the pharmacist, the nurse, the physician who's objecting to be part of this. Okay. Number two is having to do with four examples below. Which one is more than likely to undergo an abortion? And based on the Indiana Senate bill, I think many of you understood you could just go into your notes and say that the individual Emma, who is most likely, because of her fetal anomaly, a lethal fetal anomaly, is really the answer. And this is A, because it says it in Senate Bill 1, and it is only one of three exceptions. Okay. D, I'm sorry, number three is having to do again with an objection of conscience. Here's the scenario, though. Michaela is a supervising nurse where the ratio in the ICU is one nurse to one patient, but she's been informed it's going to increase. The question says, on what grounds might she conscientiously object? What is the basis for her objection? Um, and so, we know that you can see some of these, all four of these you've seen before, they're in your notes. Um, the notion of first do no harm is obviously part of the oath that healthcare professionals take, that they're not going to harm the patient. In this case, how would you harm the patient? Well, by having one nurse spread out to take care in the intensive care unit of three instead of one, might missing something, a variety of different things. This is, and of course, because this is related to duty of a healthcare professional, that really sort of falls into play. Many of you chose A, consciously objecting is not the remedy for moral distress. That is a correct sentence. In fact, that is in the title and the essence of the Nancy Berlinger article. And yet that doesn't answer the question. This is a true statement. But the question is, how is she going to consciously object to this 1 to 3 move from 1 to 1? Um, we haven't actually experienced, or the nurses haven't experienced moral distress yet. Um, and so, even though it's a true statement, it doesn't get at the question, which is, what's she going to say? And she's going to say, I don't want to harm the patients. And by going to 1 to 3, we're going to harm our patients. We're not doing our duty. So, think about putting the scenario into your own words. What would Michaela actually respond? I don't want to harm the patients. And so that's an easier way to think about how to digest these questions. Okay, number 4. What might the Abortion Stories YouTube video contribute to the ethics and law theme? And there's a number of different things specifically in the stories. But what I think is key, or what is absolutely key, is this. What is the key word here? The emotions involved are unpredictable. Let's just focus on the word emotions. I'm not sure if you remember this, but you can go to your notes so you can see all the different words that you put down. Because the question is, what emotions did you experience? And there was everything from sympathy and empathy to anger and pride and all kinds. Those are the emotions you experienced. Remember that word blob thing you did? But it was all over the place. And it really points out that this issue of ethics law having to do abortion is a lot more complex than black and white. And so, what you could do is please share an example in here. Think about an example. Examples here are always good. Okay. By the way, the other parts to this are true. They're true. And so you can see that there's true statements, but what are the ethics issues here? And because we spent so long talking about the emotions, and it's their focus on that, please. All right. Why do Dr. Roberts' patients say at times he doesn't follow his conscience? This is not a case or a name that you would recognize. It could be anybody. And you don't know what his conscience is. But one of these 4 answers explains it. Okay, so we're going to focus on A because that's the question. He is opposed to abortion. Okay, we know where he stands. But his partner provides free samples of Plan B to her patients only. Now, why then do at times, why doesn't he follow his conscience? Because he works in an environment, in a setting where he is opposed to abortion, but his partner gives out free samples of Plan B. And so just being in the vicinity, being associated, is he really following his conscience? In a lot of ways, it's no different than the pharmacist who objects to dispense the medication. They just don't want to be in the environment. They don't want to be around when that's happening. And the other 3 don't really make any sense because you don't know where he stands, and it's not an objection. It's not a conscientious issue here. So it's about the environment in his practice or the setting. All right. 6, you go right to Nancy Burling's article. Which example best summarizes a key point? And the key point here, which is right in the summary notes, is that listen, objections of conscience permissible if it does not obstruct patient access to care and is communicated. But it's really about patient access to care. So it's fine if a pharmacist says, I can't participate in the dispense of Plan B, but if they don't offer a solution, if they don't say, well, my partner can do it, I'm going to step out, or maybe this tech could do it, then that's just a problem for her. Number 7 is again about the narrative matters article, which asks, why is the author urging physicians to defend abortion? Um, and for her, where is my pencil? Uh, abortion is healthcare, right? And in fact, isn't that in the title of the article? It's about medical care. So it's right in there, and it has to do with supporting autonomy. You need to give examples from the article. Okay, number eight. Number eight was the IVF case that we didn't get to in class, but I told you it was going to be on the exam, the exact case. Um, this couple, well, this is a true story, by the way, couple who really could not get pregnant on their own. They had a cycle of IVF. As you know, it's common to have multiples. She's pregnant with triplets, but the physician asked them to consider selective reduction, which is an abortion of one or more to benefit the mom and the surviving fetuses. What's the primary ethical issue here? Um, I think you'll recall this term paradox. What's a paradox? Paradox is really an almost unsolvable problem, a puzzle that just can't be solved. Why is this paradoxical? Which, by the way, comes from wit, but it's here. Here we have a couple who can't get pregnant. They go through IVF. They find themselves pregnant with triplets. They're asked to consider selective reduction. How do they make this decision? Especially because they're very involved in their church. We don't know anything more than that. So don't jump to conclusions necessary about how, their faith informs them when it comes to this. But it's all part of the paradox. It's all part of this unsolvable and, quite honestly, unfair problem. All right. So let me go to question 10 here, a multiple choice. This is about Susan. She personally objects to abortion, but she's an emergency department nurse. She's assisted on two cases, both occurring after suspected rape. What's her stance on abortion? She's opposed to it. It says it right in here, but still supports the law. And the law says in certain circumstances in Indiana and other states, it's permissible. So um, duty um, takes precedence. Number nine is the question. You can answer this in different ways. You can say, yes, Cassie's autonomous right supersedes Mark's, or Mark's supersedes Cassie. It doesn't really matter. Some of you said, well, it all depends. Perfectly fine. But it's about the defense. What are you using? And so you need to use stuff that we've talked about. And that could be abortion stories. It could be article, could be content. You need to use stuff to back it up. Um, and just saying yes because I feel like it is not going to get you 3 points. It's just not going to happen. So I was fairly generous when it came to this. There will be another short essay question on the next exams. Really want you to focus on backing it up. Okay, folks. So look at your exam, read through this, think about it. Let me know if you have any questions, and we'll touch base. Thanks. Bye.